Hello, in this tutorial we're going to continue now with the classification of undernutrition. Now, generally, you need to know that what strictly, as we've said, malnutrition is not undernutrition. But for the sake of our tutorial, and also in many textbooks, we're going to see that malnutrition is going to be considered as undernutrition. So in this tutorial, we are going to malnutrition is going to be approximately considered as undernutrition. So in this tutorial, for the sake of your understanding, malnutrition is going to be taken as undernutrition typically. So we are going to use those words interchangeably. Is it clear? Now, let's visualize now the classification of malnutrition or undernutrition. Generally, malnutrition or undernutrition can be classified according to one, the severity. Basically, it can be classified according to the severity, where you're going to have mild undernutrition or malnutrition, moderate undernutrition or malnutrition, and then we have severe undernutrition or malnutrition. Basically, it can be classified according to one, the severity. Two, malnutrition can be classified also according to the timing. Basically, according to the timing. Number one, it can be acute malnutrition, provided that it occur within the first 3 months. If the patient is malnourished for the first 3 months, that is acute malnutrition. Then we have chronic malnutrition. Is it clear? If the patient is malnourished for the more than 3 months. Is it clear? And then lastly, we have acute on chronic malnutrition. Is it clear? When there is an acute event, that's an exacerbated malnutrition of 3 months in a malnutrition of more than 3 months. Is it clear? So that is the classification of malnutrition according to the timing. The third classification of malnutrition is going to be based on the clinical classification of malnutrition. Basically, you have clinical classification of malnutrition. The clinical classification of malnutrition is based on the clinical features that we see. So here is classified into one, you're going to have kwashiorkor. You're going to have kwashiorkor. Two, you're going to have the second one, which is marasmus. And then three, we're going to have marasmic kwashiorkor. Basically. So now these are the three major elements that you need to understand when you visualize malnutrition. Basically. Now, the next thing that I want to explain now, I'm going to explain each of these classification of malnutrition. Actually, you need to know that we are going to talk about the explanation of classification of malnutrition as the mechanism of malnutrition. Is it clear? So I'm just going to link them together. Is it clear? So now let's visualize now each of them. So we said that malnutrition can be classified according to the severity: mild, moderate, and severe malnutrition. Is it clear? Now, on physical examination, or the clinical relevance of mild, moderate, and severe malnutrition is that severe malnutrition is the one which is problematic. Is it clear? Severe malnutrition is the one which is problematic. And what are the characteristics of severe malnutrition? One, you need to know that when there is severe malnutrition, the patient is going to have all those complications that we are going to speak about later. So I'm just going to leave the complication for the session of pathophysiology. Are you understanding? So that is for the complication. For the severity of malnutrition, we said that there is mild, there is moderate, and there is severe malnutrition. Moderate, and lastly, we have severe malnutrition. Now, on physical examination, how can you evaluate the severity of malnutrition? We are going to use the mid upper arm circumference. Is it clear? The mid upper arm circumference is one element that's going to give you the severity of malnutrition. Now, for mild malnutrition, the mid upper arm circumference is going to be less than upper arm circumference is going to be between 12.5 to 13.5. And for moderate, the mid upper arm circumference is going to be between 11.5 to 12.5. And lastly, severe malnutrition, mid upper arm circumference is going to be less than 11.5 centimeter. But this is going to be best explained when we are going to visualize the physical examination of mild, moderate, and severe malnutrition. Now, the next one is based on the timing. I've already explained the element on the timing. And then the last one we're going to have now is the syndromes. Is it clear? The clinical syndrome of malnutrition. The clinical syndromes of malnutrition. For the clinical syndromes of malnutrition, we need to understand that we are going to have kwashiorkor. We have kwashiorkor as one clinical syndrome, and we have marasmus as another syndrome. Now, kwashiorkor. For kwashiorkor, we need to know that there are peculiar characteristics of kwashiorkor as the clinical syndrome. One characteristic is on the hairs. The hairs of kwashiorkor patients are going to be fine. We have fine hairs. Is it clear? The hairs in kwashiorkor. Number two, we're going to have moon phase. So moon phase is another element that you're going to have on the head of a kwashiorkor patient. The third element is that you're going to have on the abdomen, you have abdominal swelling that corresponds to ascites. You have abdominal swelling that corresponds to ascites. The fourth element is that you're going to have pellagra, and pellagra is going to correspond to a vitamin B6 deficiency. Is it clear? When you have a vitamin B5 or B6 deficiency, you have pellagra, and pellagra is actually skin hypopigmentation. So you have patches of skin hypopigmentation that shows pellagra. That is actually kwashiorkor. Is it clear? So those are the kwashiorkor syndromes that you're going to see. Now the next element is the marasmic syndrome. For the marasmic syndrome, you need to know that what are you going to visualize on physical examination? Generally, marasmic syndrome is both protein and energy which are deficient, but in kwashiorkor syndrome there is just an energy deficiency. So what do I mean? In kwashiorkor, the patient mostly lack only proteins, but the carbohydrate and fat are still present in kwashiorkor syndrome. But in marasmic syndrome, you have both protein and energy which are lacked. Are you understanding? So let's understand what kwashiorkor. In kwashiorkor, what happens is that there is mostly lack of protein. Since there is lack of proteins, you are with the problems that you are going to have. This ascites, this pellagra, this skin depigmentation are because of lack of protein, because normally the albumin is the one that is supposed to maintain the oncotic pressure. So you are going to have ascites because of hypoalbuminemia. But the patients still have a moon phase and they have a good fatty component because they eat fatty food and carbohydrate food which lack proteins. Is it clear? So they are going to have a good skin texture, but they have a poor protein content in kwashiorkor. Is it clear? And now the next element is marasmus. For marasmus, you need to know that marasmus is going to be having features of protein and both energy malnutrition. So there is both loss of proteins and there is also loss of carbohydrate and fat which corresponds to the energy. So the features of marasmus are going to be one, you're going to have the phase. Is it clear? It's called the simian phase. Is it clear? Or monkey face. So in marasmus, you're going to have simian face or monkey face. The face of these children are going to be like that of a monkey or old man face. Is it clear? So those are the different characteristics: simian face, old man face, or monkey face. The second characteristic are the hairs. The hairs in the case of marasmus are instead coarse. Coarse means that they are thick and not fine like in kwashiorkor. Coarse hair. The third is that the hairs are going to also be sparse. You have sparse hairs. The fourth is that you have wrinkling of the tissues. Is it clear? You have wrinkles at the level of the tissues. Is it clear? So you have wrinkle at the level of the skin is another element of the marasmic syndrome. The fifth element of the marasmic syndrome is that we have prominent bone. We have prominence of the bones. Is it clear? Like prominent rib cage. Is it clear? You can see the prominent tibial bones. Is it clear? We have also the sixth element. We have loss of the gluteal fat. Is it clear? Loss of gluteal fat and with wrinkling at the level of the gluteal surfaces. At the level of the buttocks, there is wrinkling. So all of that shows now a marasmic syndrome. Now you have what is also called a kwashiorkor marasmic syndrome or a marasmic kwashiorkor. Is it clear? Marasmic kwashiorkor. Now marasmic kwashiorkor is occurring now in cases where in marasmic kwashiorkor we are going to have, in these cases we have a summation of both marasmus and kwashiorkor. Among the syndrome of kwashiorkor that I've forgotten to tell you too, you have the fifth element, which was pedal edema. Is it clear? And that pedal edema corresponds to the hypoalbuminemia that these patients have. So in patients with marasmic kwashiorkor, they have features of marasmus. That is, their face is going to be like an old man or like a monkey. That's called simian face. The second element is that they can have coarse, sparse hairs. Is it clear? They are going to have wrinkling of the wrinkling at the level of the skin. Wrinkling of the skin. Is it clear? Now the features of kwashiorkor that they are going to have distended abdomen corresponding to ascites. Distended abdomen corresponding to ascites, and they have pedal edema. Is it clear? So those are the different elements that you have based on the clinical syndrome. And lastly, we are going to have also based on the timing, where you have an acute on chronic, and you have a chronic malnutrition. So all this I'm going to explain better in the later tutorial. Thank you.